afternoon.
Hello.
My name is Dr. Fowler.
I'm Anna.
Okay, pleased
And
to
this
meet
is
you.
Ellie.
Hello, Ellie. How are you? Okay, what can I help you with today?
So Ellie was diagnosed with D2 bilateral hips when we had her hip scanned.
Alright.
She was 18 months old.
Okay.
We've since put her on a special joint diet to try and help manage that. We also exercise her regularly, obviously to try and keep her weight down and to keep her muscle tone up, because I believe that that's good for the joints.
Okay.
But lately she's been having some trouble standing up in the morning. She's not quite as active throughout the day as she normally is. She doesn't play as much. She tends to lie down for most of the day, which is a little bit unlike her.
Alright,
as you can see.
Alright.
So she doesn't like staying up for long periods of time. She's not showing obvious pain, but it's just the inactivity that's got me a little bit concerned.
Alright. So, sorry, I just need to answer this quickly.
Okay. Ellie?
Hi there. Okay, alright. No, it's fine. I'm just quickly busy with the client here. Okay, alright. Okay, bye. Sorry.
That's
I
okay.
apologize for that. Okay.
That's okay.
So, tell me how old is she now?
She's just turned 3 in February,
3.
so she's 3.
Alright. You said that you do exercise with her. What? How often do you exercise?
So we go out for walks every day to obviously try and keep her as fit as possible, and to keep her weight down. We'll go to walks in the field. There's a mountain behind where we live, so we'll go for short hikes in the mountain. When we can, we go to places where there's a pond that she can swim. She loves swimming. But yeah, we exercise every day.
Okay, and do you realize any limping or lameness while she's walking or pain?
Not really during the exercise, or when we get home. It's usually only the next morning. As soon as she wakes up and as she gets up, she seems to be a little bit stiff in her movement.
Okay, and you said it's only in the mornings that she's feeling pain, not really during the day. Okay, that could be typical of the cold weather now, of the winter's coming on. So usually when the joints are colder, then they have a bit more pain there. So that could be that. But yeah, other than that, you are managing her pain quite well. Or her joint problems. So I'm not really too worried about starting up any different management, programs. But yeah, all in all, I think she's fine. And move on to the treatment now, and then we can work out a program for her to manage her pain a bit for this winter time now. Okay. All right.
Thank you.
Is it okay if I give your dog a piece of chicken?
Yes, of course. I'm sure she'd love that.
Lily, come here. Oh, Lily, good girl.
Thank you
very much. Thank you.
Bye-bye.
Okay, so these are just a few questions I'd like to ask the client. The first question being, did the vet make you feel comfortable when you entered the consultation room?
Yes, I think so. She was friendly and welcoming. So, yeah.
Okay, another question. Did the vet give you enough time, or did she interrupt you between your questions?
No, she gave me enough time to explain. If she wanted further information, then she would ask more specifically. But yeah, I felt like I had enough time to communicate the problem to her.
Okay, awesome. Did you feel that you were listened to?
Yes, I think so. It felt like the feedback that she gave me showed that she understood what I was explaining to her.
Okay, awesome. What did you like about the consultation?
I liked that she was friendly and welcoming, and that she gave me time to explain everything in detail. And yeah, I generally felt like she cared about Ellie and about Ellie's condition by listening and also by giving suggestions and feedback.
Okay. And the last question is, do you have any negatives or criticisms on what she did or how she carried herself?
Well, there was an awkward moment where she got a phone call
Yeah.
and she let slip some colourful language. And yeah, I don't know if it's all that professional to take phone calls in the middle of a consultation with a client. So that was maybe the one thing. But yeah, I think overall the visit was great. She gave Ellie chicken as well.
Yeah.
So it's a nice way to finish it off. So I'm sure Ellie likes her.
Awesome. Thank you so much.
Thank you.
Okay, now I have a few questions for you, the vet. Did you feel the consult was an easy consult or a difficult consult to conduct?
I felt it was easy. The client gave me enough info to understand what is wrong with the dog. I didn't feel like I had to drag the information out of her, so yeah.
Did you think that you communicated effectively?
I do. Well, I tried to. Yes, I tried to make the client feel like I'm listening to her, and I tried to refer back to her previous information to help her to understand that I am listening to the info she's giving me. So yeah, I hope that I did communicate effectively.
Okay, awesome. And did you feel that you got the information across that you wanted to get?
Yes, when I did tell her that she can consider hydro, then she did say that she would like to take it further, and she also seemed like she was open to me giving her info on how to further her management on the dog's problem.
Okay, awesome. And if you, how would you have done anything differently in this consultation? If you had to do anything differently, what would you do?
If I had to do anything differently, well, yeah, maybe I shouldn't have answered my phone during the consultation. Yeah, because that's a bit rude. So yeah, maybe next time in the next consultation I shouldn't do that, because then the client feels like I'm not giving her enough time. So yeah, that's...
Okay. Thank you so much.
Okay, thanks.
Yes, I'm Kaylin and I had to evaluate the consult. So I feel like the consult got off to a very good start. Our doctor, Dr. Carla, introduced herself very well and got down to the dog's level, which would make the client feel like she cares about the animal. And then when she started asking questions, she asked open-ended questions and allowed the client to speak her mind without interrupting her. In the middle of the consult, she did hit a bit of a speed bump with her phone, which she shouldn't have answered her phone. If in the beginning of the consult she had said to the client, listen, I'm expecting a very important phone call, do you mind? Then it would have made it okay, but just getting up, answering your phone call in the middle of a consult, it's not very professional. And the language she used in front of the clients is very unprofessional language, so that should not be done. She was, but besides that, looking at the good points, she was a very good listener, and she asked questions that related to what the client was saying. So she didn't just ramble on about random questions, she would listen and ask relevant questions on what had already been said, allowing the client to elaborate on the issue. Towards the end of the consult, I felt like she started asking slightly more closed-ended questions, but I feel like this is a natural progression of the consult. As you get further along, you kind of have to ask more narrow questions once you get there, but that could have maybe been avoided. And then a very nice touch, which the client would have appreciated, and Ellie, the treat that she gave, it just creates a nice environment and makes it a lot easier for the client when she wants to bring the dog back.
Hi, I'm Katie and I was the convener for this video. Good day everybody, my name is Keenan and I was the videographer of this video.
Hello, my name is Carla and I play the doctor.
Hello, I'm Kaylin and I played the evaluator.
Hey, I'm Session and I was the interviewer.
Hello colleagues, I'm going to be facilitating a discussion. So Sashin, what was this exercise like for you?
This exercise was really cool. It taught us how consultation should be done and how not it should be done. And it helped show me that the stressful life about being a vet, and as well as certain questions that should be asked and how to conduct yourself in the professional world.
Thank you. Kaylin, can you share something valuable that you learned from this experience?
I think that something very valuable that we all learned, well specifically myself, is the importance of open-ended questions versus closed-ended questions, and how those can help facilitate to get information from the clients instead of just asking these closed-ended questions that lead nowhere.
Great, that's very helpful. Yinan, what improvements do you think could have been made,
Well,
if any at all?
Well, as the videographer, I think I should have maybe used one card in the video camera, because like we had to stop it and then look for other cards, and also like time management of ourselves, like communication between ourselves. Like I think to the end it got up, it died a bit, but then communication I would also improve between ourselves, and yes, that's all for now.
Okay, great. Carla, you are obviously our vet, so I think this would be a nice question for you. But how will this exercise influence how you practice one day? And is there anything you would do differently?
I think what's good about this whole exercise is that we learn how to treat clients differently. Whereas most of your clients or most people, when they talk about vets, they always say that either the vet treated the animal badly, and that's most of the time why the client wouldn't go back, and or the vet didn't listen to them. So I think it's very important for vets of today to learn how to communicate with clients, how to make them feel like you're listening to them and to show empathy. And not just think about the problem and treat the animal as, you know, just your next client, but to try and individualize your clients that you see, to make everyone feel like they are having a separate consult with you, make them feel valued and not just something that's in a process, you know, dog in, dog out all the time.
Yes. Great, thanks Carla.
Okay.
And then lastly, a question for all of us. Did you find this assignment worthwhile and why?
I found it very worthwhile. It taught me to work with people that I'm not comfortable with on a daily basis, but now we become friends. And basically, yeah, communication skills is the most important for me. That's what it taught me.
I think it teaches you that you can put all this planning in, but as soon as you put into the situation, things don't always go according to plan, and you kind of have to just make it up as you go along. And I feel like in private practice or in consulting, excuse me, you kind of have to go with the flow and make it up on the spot, if that makes sense.
Yes, and that every client is different, and that sometimes you would have to adapt your way of thinking and your personality to fit with the client and to make them feel comfortable.
And it's like the thing is, all of us are different personalities. As we have seen in our first VPL video, that none of us are the same. And as you practicing as a vet, you will not have the same people coming. You will not have the same clients, patients. Everything that you're going to be working with is not the same. And you would have to not improvise, but use the knowledge that you've learned and use it. And doing this video helped me a lot to think more out of the box than just the normal inside the box type of things.
Thank you so much. Thanks guys for your input and contribution. And lastly, we would like to thank Ellie. Ellie. Come. Ellie. Sit for me. We'd just like to thank Ellie for taking time out of her busy schedule. Thank you, Ellie, for starring as our patient. And we'd also like to thank our sponsors, Hills.